We are so excited for you to start your orthodontic journey with us. You have received your starter kit for your braces, and we just want to go over everything with you so you know how to properly clean and the do's and don'ts with braces. So first, we are going to talk about your cleaning kit. This is very, very vital for the start of braces. The first thing is your toothbrush. We give you a regular size brand new toothbrush as well as a travel toothbrush. This can be awesome for when you're at school and if you want to brush your teeth at lunchtime. Typically for patients with braces, we ask them to brush at least 3 times a day, if not 4 times a day. And you're going to take your toothbrush and make sure you properly angle it above the brackets in a circular motion, as well as below the brackets. This is very, very important because you want to make sure you get on top of the bracket, around the gum line, as well as underneath. Same thing on the bottom. You want to angle it towards your gum line, circular motion underneath of the bracket, as well as above the bracket. There's a couple different ways you can floss. We give you regular floss that you will use with our floss threaders, as well as what we call a platypus. This helps, it's just a little bit easier way to floss than with the floss threaders. We find that patients prefer these over the floss threaders, but we're gonna go over both because we give both to you. You are going to take the flat end of the platypus and go underneath the wire and ensure you get both sides. Same thing. You're just gonna head all over all the brackets, just like this. And to give you a little view of the bottom, same thing, flat side is gonna go underneath the wire in between all your teeth. Now for the floss threaders, they work just as well. Can be a little bit more tricky, but whichever way you prefer, this is the floss threader itself. And then you'll take a piece of floss and you will take the floss in between the little loop on the floss threader, just like this. And then you will take the threader, thread it underneath of the wire, all the way through. Can be a little tricky, and floss in between just like so. And once you take it out, you pull the floss all the way through and go on to the next tooth. There's a couple different kinds. This is the most common that we use. This is really gonna help for in between the brackets, as well as above and below the brackets if you have a piece of food that is caught between there. But you're just gonna take the Christmas tree brush and you are gonna slide it on just like that, in between each bracket. And that will help with really hard to reach areas. One area that I find that it's really nice to use is where your bands are. This really helps if you have a piece of meat or a piece of bread that got caught in there, you're having trouble brushing it out. It really helps. The other proxy brush that we have is a little bit smaller, and use it the same exact way, in between, just like that. You may not have to ever use this, but just in case you feel a pokey wire or you feel like a band is loose, you can use this to explore in your mouth and see what could be bothering you, to let us assistants know specifically what is going on in your mouth to give us a better idea. Like I said, you won't necessarily have to use this, but we give this to you just in case. Some toothpaste. You can use whatever toothpaste you use at home. We recommend Colgate. But any toothpaste that you are concerned about, that you have a question, you can always ask us, but we do give you a sample of the stuff that we recommend. You can also put in your lunchbox with your travel toothbrush. in case you want to brush your teeth when you're at school. The next thing is going to be very important. This is wax. You can always ask for more wax from us, but this is going to help be your saving grace if you have a pokey wire, or if something's rubbing or causing soreness to an irritated area. You're going to take off a piece, depends on where you're putting it in your mouth. A lot of times we see that with pokey wires, this helps a ton. Sometimes brackets can be rubbing the area, but you want to take that piece that you've taken off, however big you need it to be, and kind of roll it in your fingers to where you can manipulate it and cover the area that is bothering you. We have a little pokey wire on this area. This piece may be a tiny bit big for this spot, but it will definitely help the patient not feel the pokey wire. Place it just like this. It actually covers that whole bracket right there. A little too big, but it definitely will help this patient not feel that pokey wire. Sometimes patients find when they first get their braces on that they need to cover an entire area of their braces. Longer pieces are better. However big the area is that needs to be covered, wax will definitely do the job with that. Last thing in your kit is going to be, your cleaning kit is going to be Listerine. We recommend that you rinse with some type of mouth rinse to help with the cleanliness and oral hygiene. But again, you do not have to use this if you do not prefer to use it. That is everything in your cleaning kit. We are now going to go over a couple other items in your starter kit. The first are the information cards. We have our point system. You can read that, and after you get your braces off, you can cash in some points you've earned throughout coming to see us for your regular scheduled visits. Every time you come to the orthodontist, we want you to have as much fun as possible. So Dr. Garner has created our point system. And every time you come, you should be receiving points, whether you have really, really awesome oral hygiene, you went and saw your dentist. We recommend that you see your dentist at least 3 times a year versus the average twice a year. But if you see your dentist regularly for your cleanings, if you get A's on your report card, you can get points. So please let us know. We do want to know about those things because we love all of our patients and we want to know how you guys are doing. If you won a gold medal or your baseball team won the national championship, we definitely want to know all of those things. So send us some pictures, as well as we'll give you some points for that too. At the end of treatment, it's really awesome. You can cash all of your points in for certain prizes. If you have even more than all of these points, if you go above 60, let's say you have 120, you can cash those in for multiple of these prizes. We will explain a little bit more of that as we get towards the end of treatment. But that is our Gardner point system. One thing is, in your starter pack that you received today, we have given you a t-shirt. Fun little t-shirt. Could be this one, could be a different one. But if you wear your t-shirt to your appointments, we give you points for that. We are now going to go over what to eat and what not to eat with your braces. First things first, a lot of things that are sticky and chewy. So Laffy Taffies, caramels, any candy bar that have caramel in them, Snickers, Milky Ways, things like that. Also Airheads, Jolly Ranchers, Mentos, Starburst, Jelly Beans, licorice. All of that stuff is considered sticky and can break and damage your brackets, wires, etc. One misconception is that peanut butter is not allowed to be eaten when you have braces. Peanut butter is totally fine. Anything hard or crunchy, so pretzels, pizza crust, reheated pizza crust, regular pizza crust is fine. Nuts and ice. Ice is a big one. Try really, really hard not to chew on ice. If you like to have ice, you can definitely suck on the ice, but no chewing on the ice. The good stuff, the things that you can eat with your braces are going to be popcorn. A lot of people think that you cannot have popcorn when you have braces, but we are totally okay with you having popcorn that is popped all the way. If you are scared to eat the popcorn and you're worried that something's gonna break or cause discomfort to you, you can definitely try Pirate's Booty or Popcorners. That's a great alternative as well. Chips and tacos can be eaten as well. We recommend that you break them into small pieces and then chew in the back, towards the back of your mouth. You can chew gum as long as it's sugar-free. You can eat raw veggies, but just cut them up into smaller pieces and chew in the back of your mouth as well. Sweets and sodas are okay as well, but make sure that you brush immediately after. And just remember that broken appliances take more time. So if you have a broken bracket or a broken wire, this can delay your treatment. So try and avoid the things that we mentioned, the sticky, chewy, gummy foods. Another thing I didn't mention was the corn on the cob. Try and eat that off of the cob, as well as ribs or chicken legs. Pull the meat off of the bone. And if you really like apples, try and cut those up and eat those towards the back of your mouth, as well as other fruits and vegetables, as I had mentioned. Avoid sucking on lemons. This is kind of, all fields of dentistry, we want to kind of stay away from sucking on lemons just because the acid, we don't want it to damage your enamel. And that is pretty much it as far as the things you can and cannot eat. Just remember, like I said, it can delay your treatment if you're constantly having things broken due to the things that you eat. If you have any questions about anything, you can refer to your what to eat in your starter pack. Now, emergency. What is considered an orthodontic emergency? There are no true orthodontic emergencies unless you are profusely bleeding, which I hope never happens. But there are some common things that we consider an emergency, and we're going to go over those now. The first is discomfort. Every patient is different as far as how sore they are going to feel. Sometimes we have patients that are sore every time they come to see us just because their teeth are more sensitive and involved with the movement of their teeth. However, we have patients who really never experience soreness. So it really just depends on the severity of your soreness. Nothing is going to be extremely sore. Soreness is very typical because we are moving your teeth. We are trying to get them in a better position, so that is very typical. We recommend Advil or Tylenol, whatever you take for headaches. Just ask mom and dad, let mom and dad know that you are experiencing some soreness, and that should relieve it. Sticky things like pokey wires, that is what the wax is for. That will definitely help you, as we have showed you. If you feel comfortable with clipping a wire that's pokey, you can definitely use some fingernail clippers. Cuticle removers work awesome. Just make sure they're clean before you use them. But of course, if you don't feel comfortable having mom or dad clip the wire, you can always contact us and we can see you to clip that wire. The next thing are going to be ulcers. Ulcers can arise due to the brackets rubbing or the bands rubbing on your cheeks or your lips. Again, wax will be very important with those conditions. Not all patients that have them, so you may have one arise, but just know wax will definitely help with that as well. Broken bracket or a loose band. Broken brackets and loose bands we definitely want to know about. We will make you as comfortable as possible when you come to see us. We may not replace the bracket when you come to see us. It may just be considered an appointment. We're just trying to make you comfortable, whether that be removing the bracket or removing the band. When you come for your regular scheduled visit, we will replace the band or we will replace the bracket, whatever needs to be done. Again, if you have a wire break or a wire is poking, wax helps with the pokey wires. But if you have a wire come completely out, please notify us. Again, we may just replace the wire and retie everything and send you on your way until we see you for your regular scheduled visit. But just know most of our emergencies are comfort. We want to make you comfortable. We don't want you to be in any discomfort whatsoever. After hours, we do have an emergency line. It will prompt you, once you call our main number, it'll prompt you if you have an orthodontic emergency. to dial that extension, it will go to our on-call assistant, and they will be able to help you with whatever discomfort, pain, soreness, anything like that that you have. This one is just a little summary of everything that I've gone over with you guys today. Of course, if you have any questions at all, please feel free to call us. We are always here for you. We love you, and we are so excited for you to get started with braces.